What is up, everybody? It's Dr. Vibe here, host and producer of the award-winning Dr. Vibe Show, the home of Epic Conversations, and I'm the host of Epic Conversations 2020, Best Podcast News Award winner, 2018 Innovation Award winner given out by the Canadian Ethnic Media Association. I also co-host and co-produce the only online show in the world for dads and fathers. It's sponsored by Dove Men Plus Care. And being part of that team, our team has reached out directly and indirectly to over 300,000 dads, fathers, and caregivers around the world. So that's a lovely opportunity. Also, I am a contributor to the Fly Nubian Queen YouTube channel, which is a place where Black women have a voice. And we've got an outstanding Black woman that's going to be with us in just a moment. And that site or that YouTube page has 581,000 subscribers. Also, I am a featured contributor on another platform called Indie Soup Media, which has a reach of over 1 million people. It's based out of, the US, but Dr. Tachi, another incredible Black woman, runs that. So you see, I'm aligned with Black women, and we're actually broadcasting this on Fly Nubian Queen. So I gotta represent. So before we get into it, please subscribe to the Dr. Vibe Show on YouTube and hit the notification button. And please follow and like me on Instagram, Facebook, and YouTube. And if you want to advertise your business, product, or service on the platform or any of the platforms that I host, please email me at dr.vibe@thedrvibeshow.com. Well, this is good because this, I think, one of the first times I had a one-on-one conversation with an outstanding Black woman on Fly Nubian Queen. And you know what? I'm just going to bring her up. Dr. O. Hey, otherwise, Dr. O, give your full name so people know, so they know who you are.
Okay. Well, thank you for having me. So yes, my name is Dr. Onye Nnorom. Super long. If you want to go African with it, then it's Dr. Onye Nnorom, but AKA Dr. O. Here in the house with you. Thank you, Dr. Vibe, for having me.
Well, it's a pleasure and joy, and I'm looking forward to an epic conversation with you. And wherever you're watching this, especially live, please put questions, queries in the comment section. This would be very, very good time to get these epic conversations in. So let's go back. Where did the journey start?
Okay, which journey are we? So many journeys.
Your own journey. Wonderful Black woman.
Yes. So I'll kind of center it on my journey into medicine, but I am half Nigerian, half Trinidadian, born and raised in Montreal, and now working and practicing in Toronto. My parents were very involved in community and always very engaged. So at an early age, I had a strong sense of community, and I brought that into medicine when I got into medicine. At a very young age, I was exposed to racism, and I wanted to be like Nelson Mandela and Martin Luther King and address issues of social justice, because that's what my parents instilled in me to kind of deflect the racism I was experiencing in elementary school, to know that it wasn't me that was the problem, it was them, and I needed to know who I was. So I brought that into medicine. But a huge part of my journey was, my parents were not professionals, and I came into the world of medicine actually through mentorship. So Black community mentorship, some of the Nigerian and Ghanaian doctors associated with McGill University. So that's one of our big universities in Montreal or in Canada.
Yeah.
And they were running a mentorship program, and I wasn't sure if I wanted to do medicine, but they really encouraged me. And the village lifted me up. And so that's part of the foundation of my work now. I'm a family doctor. I'm public health and preventive medicine specialist. I'm assistant professor at the University of Toronto. And I have led a number of initiatives to improve Black health, racialized health, or minority health, and mentor the youth coming up as well. So that was instilled in me by the village. I carry that with me as I go up, I lift.
Wonderful. Tell me about growing up. Was this a discipline or area that your parents wanted you to get into? Because many people from our background, our parents, like my dad said, I want you to become an accountant. And obviously that didn't work. So was the push and drive coming from your parents to have a profession?
It's funny because as a kid, I didn't feel it. But looking back, it was there, right? So they just wanted me to do well in school. But I was actually, I know some people talk about those times in school where a teacher, the parents are like, what happened to that 3% on the 97%? I was like that. Like I would skip recess and be like, it's like I'm in grade 4. I'm like, can we have a conversation? I'm not going out for recess. I got a 97% and I need to understand how that happened.
Yeah.
Right. So that was part of me. But I think my parents, I think a lot of parents, usually the list is like doctor, lawyer, engineer kind of thing. They didn't push that. But I know that when I was 5 years old, we were living in a low income neighborhood. You know, there's like roaches and that kind of thing. And my parents want to aspire, you know, they're trying to get out of that, and we did get out of that, that community setting or that neighborhood. But she worked as a typesetter for a newspaper back where newspapers were, you know, physical.
Oh, yeah. Yeah.
Right. And you needed a typesetter. And they interviewed me and they asked me what they wanted me to be, what I wanted to be when I grew up. So I'm 5 years old. I say I want to be a bus driver.
What?
Yes, because I had a woman bus driver. I mean, she was a white woman, but at that age, that wasn't, you know what I mean? It wasn't about race. It was that she was a woman and she was so kind, right? Because children gravitate towards kindness. She was so kind as a bus driver. So I said I wanted to be a bus driver. And I'm 5, I'm in kindergarten. I can't read yet. My neighbor, Anne-Marie, the little girl, she said she wanted to be a doctor. So I don't know if it's that my mom always wanted me to be a doctor or she didn't want to be showed up by the neighbor's daughter. But what ended up in print was that I wanted to be a doctor.
Wow.
So I said bus driver. But they didn't push it. They didn't push it on me. But when they found out about the mentorship program, it was my mom who found out. And you could say it was divine intervention. She happened to go see a doctor about her thyroid, a specialist. She only saw him once, actually, because her thyroid issues went away after that. Mm-hmm. But she went to go see him, and he said, he just happened to say, you know, after the clinical assessment was done, he said, oh, do you have any children? How's your family? And my mom talked about me, how I was, at that time, I was studying cell and molecular biology. I was getting high grades. And he said, well, it's interesting because I am running a mentorship program. Tell your daughter to come. So that is how I ended up in the mentorship program. It's because my mom happened to have a thyroid issue that actually went away after she saw this doctor that one time. It went away on its own. So she wasn't even on medication for it after it went away. But after this one time seeing him, I got connected with the mentorship program. And it was with that support of all of those doctors and that support that I ended up pursuing medicine.
How, just one more thing about your parents. What things did your parents instill in you at a young age that you still carry on today?
Ooh, so much. But I mentioned that sense of community, and I think that has been huge for me. And I fully recognize the value of it when I got much older and actually when I entered fully the field of medicine, because my parents coming here as immigrants, you know, whatever little they had, they shared with others, right? Even though we weren't rich. They were part of community where they could tell somebody who, you know, let's say they don't have their papers, right? Today we would say undocumented, but back then you say this person doesn't have their papers, but the person needed a job or the person needed access to healthcare, needed their fibroids removed. They knew the kind of people that would help, you know what I mean? Help people along that journey to be able to work and to be able to advance themselves. Much later in my journey in medicine, I realized that those kinds of ways that we help each other, that we show each other opportunities, that we kind of resist any structural barriers and come together, those things improve health. They're called the social determinants of health. You know, very fancy language around social connections, education, access to jobs and things like that. Those actually improve people's health. And my parents were doing that and showed me that in community. They didn't even call it volunteer work. It was just how we lived, right? And sometimes people lived with us for a short amount of time, you know, as they were on their journeys. Again, we didn't have much space, but people, you know, who are struggling sometimes live with us. So I carried that into medicine. And that has informed a lot of the work that I've done around, cancer screening. So some of the work that we did were we applied community, principles, African principles like Ubuntu, which comes from South Africa, of I am because we are, of unity. So I learned the unity, not that term from my parents, but the unity. And then a sense of pride in who I am. So my parents were big on know your history, know who you are. And again, those helped me a lot in medicine when, I don't look like the doctors you see on TV, or maybe even the doctors that you might have had growing up, depending on where you grew up. And so I had to have that kind of shield to be able to say, no, I'm here for a reason. I have my ancestors behind me. I have I know who I am, and I came to do something, right? And so that was powerful for me. And I think I was also motivated by my parents' struggles. I saw how hard they worked and how tough it was. My dad was a maintenance worker. Later, my mom lost her job from being a typesetter, and she did maintenance. And I think, my parents have been very proud. They were proud when, I could put up on my office door, Dr. Onnoram, because for so long they cleaned offices.
Oh, wow.
They did. And I remember going with them when I was a kid, when they would clean, or they would clean boardrooms. And now as a physician, I'm a physician leader. Like, I enter the boardroom often to chair the meeting, but one generation ago, my parents were cleaning those types of rooms. So I think there were the things that they instilled in me, but there are the things that I observed where I knew I wanted to, make them proud and carry that legacy, because they both had, like college education. But, especially in Montreal for Black folks, the statistics are pretty significant. Like back then you could have a graduate degree and still have the same unemployment rate as a non-Black person who had dropped out of high school. There was actually a study that showed that. So to honor, what I mean, their hard work, I'm proud that I'm able to do that.
Share the moment you had with your parents when you graduated.
Ooh, oh my goodness. So I told you my parents were involved in community, right? So it was like, they threw a big party, but even at the graduation day, so at McGill University, the graduation is outdoors. So it's pretty much unlimited. The whole community showed up. And on the Caribbean side, the African people flew in from other countries, the head ties, the whole thing. At our house, the house was decorated, what else was going on? The Black community paper, Community Contact, that was led by Dr. Mr. Egbert Gay, may he rest in peace. I was on the front cover of the Black community paper, right? It was big. And there was a night party and a fete for those who are Caribbean, a fete.
Fete.
Whole thing.
Yes. Wow.
Whole thing.
That's great. Before we go to break, was your journey becoming a medical practitioner always easy?
No.
And I'm asking that on two ends. Yes, I know it's difficult, but was there any anti-Black racism along the way? I want you to go into that.
Okay, after the break or right now?
Right. You know what? Let's take a break, and then we'll talk about your journey, and then, especially because we have a number of people watching live from the United States, give them a vision of the state of Black health in Canada. Okay. All right. Yeah. All right. So this is going to be educational and the whole 9 yards. So you're watching the Dr. Vibe Show. We're broadcasting live with Dr. O, and we'll be back in 2 minutes. And we're going to get a little education of the state of the Black health in Canada, because we have a number of people who are not from Canada watching. You're going to get some education. All right. So keep it locked. We'll be back in 2 minutes.
And that's what I feel like. You feel like you're the Harriet Tubman of the mind.
I am.
I feel like I'm I'm one of the Harriet Tubmans of intelligent Black people. Like, I want to liberate y'all from being left behind and ignored and oblivion. Now, really, the rappers get all the attention. Seriously, does anybody else feel this way? Like ignorant Black people, they'll be all up, getting all the headlines on the Shade Room.
Overly sexualized Black folks.
Like the twerkers and the just people that, don't always represent the best of us, the diversity, like people like Dr. Vibe. Like everybody should know about people like Dr. Vibe. Dr.
really
Vibe
should.
he's trying to do good work for Black people. Dr. Vibe from Toronto. Good to see you, my brother. Dr. Vibe. Everybody follow Dr. Vibe. He has a great show. He's very good at what he does, and I have a lot of respect for him. The men who are also doing the same thing. I see Dr. Vibe in here. He's a great brother. Everybody should follow Dr. Vibe, by the way. He's a smart brother in Canada, and we need to follow smart people. So follow Dr. Vibe if you see him in the chat. And Dr. Vibe, say your name in the chat so people can see you. I want you to click on his name, and I want you to go follow him, please, because I want these men and women that are doing the right things to get the support they deserve. Hey, Dr. Vibe, how you doing, brother? Again, like I always do, I got to say everybody should go follow Dr. Vibe. He's got a great show. Dr. Vibe, I know Dr. Vibe's got a kingdom because I see your channel. I see you pouring into that every day. Everybody should follow Dr. Vibe, by the way. Look him up, Dr. Vibe, V-I-B-E. He's a great friend of me and my wife, and I love this guy.
Okay, so let me hop into this. What's up, Dr. Vibe? How you doing? Everybody, if you see Dr. Vibe in the chat, everybody go follow the Dr. Vibe show. Dr. Vibe is a real smart brother and a good human being. I like the guy a lot, and he's very intelligent. And I think everyone should pay attention to what he's got going on. We got to shine the spotlight on the intelligent Black people out here that are really doing the good work. Don't just pay attention to the rappers and the celebrities. A lot of these people are losers. Your true winners are your people in your community that are really having your back. Helping us to have stronger families and a stronger community. So Dr. Vibe is in that category. So you might see the Dr. Vibe show in this chat. If you see him, please go follow him. Okay. All right. So anyway.
All right. We are back, and always big thanks to Dr. Boyce and Dr. Alicia Watkins. I'm actually speaking it out there that one day I will have on this platform Dr. Alicia and yourself, because Dr. Alicia Watkins has her PhD in social work. She teaches social work. She also has she's a certified trauma specialist, and also has been counseling Black families and Black couples for over 10, 11 years. And also she also works in a hospice.
Oh, wow.
So this, I'm speaking that's going to happen. I'm going to see it on my monitor one day that I'll have, and I'll just get up and leave. By the way, when you two get on, but Dr. O is back with us. And before we went to break, wanted to get in, really now start getting deep into the whole area of anti-Black racism in the medical profession. But I want to get it from her lens when you were aspiring to become a medical practitioner. Share some of that with our family.
Yeah, you know what? I had experiences of racism, and I also observed, Black patients being treated differently very early in my career. So, I mean, the first day of medical school, I remember, so at McGill University, it's a Canadian university. At that time, they didn't have any kind of Black community, like affirmative action kind of thing, like where you can have a pathway. Now those exist, but back then it didn't exist. That didn't stop one of my classmates from coming up to me, again, first day of school, I don't know you, coming up to me and telling me, oh, you know what? It's great that you got into medicine the fair way. And then proceeded to say some disparaging things, because at that time there was a program where if you came from a rural part of Canada, which is like French white Canadian, that you would have, you could have slightly lower grades because they're rural in a different context and get in. But why? I was the only Black girl in my class. Like, why are you coming to me to tell me it's so wonderful I got in the fair way? Again, I don't know you. So that was like day one of feeling, different. Class was also an issue. Class in the sense that like I said, I came from a lower income background, and most of these kids were very rich. So they were having conversations about, their nannies. Whereas I came from a neighborhood, like a lower income neighborhood, where many of the women left their children to be nannies in these types of neighborhoods, right? So it's a very uncomfortable space when people are speaking in a certain way, right? So with class and race, there were ways that I felt very much like an outsider, or assumptions being made about me. So, if once I'm in my, in the hospital in my white coat, and people not understanding that I was a medical student, but thinking I was, I don't know what they thought because I was wearing a white coat. And then in residency, introducing myself as Dr. Onnoram And people, you know, like as a resident, you can still, you know, have a plan for the patient coming out of a room. So I'm still a trainee, but I can, you know, have the plan, discharge the patient, come out of the hospital room after speaking to a patient for 10 minutes and their family, only for the people to say, oh no, well, you know, the person we spoke to, they might've thought I don't know if they thought I was a nurse or something else, but they're like, we're waiting for the doctor. And it was like, I introduced myself as Dr. Onnoram. You know what I mean? So those things, actually, we did a study on it. So I led a study on it that was published in Academic Medicine it was actually released in 2020, but we surveyed Black doctors. Because sometimes when we give these like one person, you're like, oh, maybe it's a pattern. It's a pattern up here. And for Black male physicians often being mistaken for orderlies, or, you know, let's say you enter the room where the residents are, you know, where you're supposed to change into your scrubs and being told you're not in the right place. This is for doctors.
Right.
You know, like just all kinds of assumptions. People asking us, usually if somebody says they're a doctor and they're white, people just kind of take it for granted and move on. With us, we're asked more about, so where did you study? And like, you know, all these, almost like they're taking a CV kind of questionnaire of our credentials. In our study, there was even examples of doctors being asked by the nursing staff and other doctors if they knew how to twerk.
Come on.
It's in the study. It's in the study. It's in our paper. All kinds of assumptions and stupidness that I've been through, but also you know, many Black physicians have been through. To the extreme, you know, if we want extreme, it didn't happen to me, but in 2016, there was a surgeon, and it's a public report, so don't worry, we're not going to get sued. It was a public report with an inquest where a surgeon, a white surgeon, had a disagreement with a Black physician and hung a noose.
Get away.
On the operating room door. And then there was an investigation that found that there was no racism anywhere in that hospital. So it happened out in Alberta. That was 2016. And then the case went on into like, I think 2021, because people protested when like the inquest showed there was no racism, not even with the news, but anywhere in that hospital, nowhere, a whole hospital with no evidence of racism. So it was investigated again, but no, oh my goodness. Within the field of medicine, lots of racism. And then towards patients, so many assumptions about Black folks, you know, almost like we need to do better to be healthy without realizing how anti-Black racism every day, the stress of being Black impacts, you know, diabetes, high blood pressure, the way people might cope with overeating just from the stress of anti-Black racism. And then when you go to get care, you experience racism on top of that. And this, again, the studies here for Black and racialized people of feeling dehumanized, feeling like they're getting second class care. For Black people, Indigenous people, you know, situations of people even turning to social media and then, you know, crying out for help because of the mistreatment that they were experiencing, both Black and Indigenous people. There are cases like that. And then ending up dying either in hospital or, you know, some people, there was one where a young Black man took his life. He said, somebody help me. But they called security on him because of some clerical mistake they made about his name. Because he was like, I was here. Young man, 24. He's like, I need help. I was here. I've come back because I need to see the doctor again. And they said, oh, you're nowhere in our file, because they had misspelled his name. And he's crying for help. And he goes on social media, I think it was Facebook Live, saying, I need help. I need help. They called security on him, escorted him out forcibly when he was asking for mental health support, and he took his life a few hours later. So that's another inquest that happened here in Canada, where racism, it was recognized that racism was an issue. You know, I don't want to, you know, create trauma in this space, right? We were just talking about trauma-informed care and things like that. So I'm not going to go over case after case, but simply to say, especially for our American audience members, like anti-Black racism is a global phenomenon, as we saw during the pandemic, right? And the ways that after the murder of George Floyd and the video went, you know, across the country, many countries across the world, yes, were coming out to speak to justice for George Floyd, but had many local examples of anti-Black racism that was happening in Canada, the UK, and France, and other areas like that. So this is the kind of thing that needs to be addressed in medicine, because if you recall, unlike any other field, we take an oath to do no harm. So we're at odds with what we have set out to do.
Understood. When did you
I think.
Can
Hello?
you hear? I'm here. Okay.
It was you or me. I was like,
No problem. No. When did you decide or make the decision to become an activist in this profession? Because you're a Black woman. First of all, being an activist in the medical field.
Yes.
Being a Black woman that's an activist in the medical field.
Yes.
When did you say, okay, I just can't sit back?
You know what? It's interesting. I don't think I ever sat back properly.
Yeah, okay, there you go. Okay, true.
From the beginning. And also I more self-identify as an advocate, because that is one of the competencies of medicine here, that you're supposed to be a health advocate. You're supposed to be a medical expert, a scholar, a communicator, but one of them is advocate. So the way I'm able to make it palatable to the universities where I teach is to say I'm more of an advocate, a health advocate. And what's interesting is, again, I told you my parents were always involved in community. And so, and I was always interested in issues of, racism and justice. So in medical school, I was involved in, some global health work, and HIV related, advocacy. And then I also, worked with another classmate to go to the local YMCA and teach, newcomers like refugees and things like that about their health and how to adjust to their Canadian, environment. And so there were just ways that I just continued to be involved in that way. And then in the Black community, I became the co-president of the Quebec Black Medical Youth Initiative, right? So that's where we would do outreach, which is still related to the work that I do today, right? Outreach to encourage youth to enter the field of medicine, because I had benefited from that. So I think it was always there. It's just I was fortunate enough to end up in a field of medicine. So this doesn't quite exist in the United States in the same way, but it's called Public Health and Preventive Medicine. And so it's an area of medicine where you think about populations and you think about communities. And so, during the pandemic, I guess those are what you call the medical officers of health, like the people that you saw on TV saying, this is what we need to do. Right. But I don't do it at that level. I did it deciding to focus on Black communities and other communities that face injustice. So that's different. And I made that decision pretty early on, because once I got into medical school, community members were asking me about, okay, what are the statistics on fibroids? What are the statistics for Black Canadians about diabetes? We're hearing about it in the States because y'all have real good statistics in the States, right? Yes. Maybe not the best outcomes, but definitely really, really, really strong data to be able to advocate and address these issues. So even as a second-year medical student, even though I was only a medical student, members of community were contacting me for help. And when I did my research, I realized that there wasn't a lot of research on Black communities here and our health. That's still the case, actually, but it's improving. And so that kind of started my journey, probably from second year of medical school, of a real fascination and passion around Black community health. And then much later, I started to realize when I entered working that a lot of our health issues in Black community were so much worsened, if they were not caused, worsened by anti-Black racism, right? Like when you can't get good housing and you can't get a good job. Even when you get the good job, in Canada, a Black woman, you were mentioning women, a Black woman is 1.5 times more likely to be overqualified for her job. So you're working more, even though you have more education, you're getting paid less and working more. And then when you get pregnant, that's having an effect, right? In the womb. That's stress. That's stress from the blood pressure and the eating and all of the stress. Maybe something's happening to your brother. Something's happening to somebody who doesn't have housing. You're trying to put it all together, work. That's going to have an impact on the unborn child, right? Into the next generation. So it was when I started to learn all of those things, I felt the need to do research, work and collaborate with allies and community members to really have an impact. So the Black community piece was early. The understanding about how racism really impacts our health came a little bit later, but it was all during my training, to be honest.
Excellent. Well, you have a number of different vehicles that you put your energies into. So which one do you want to talk about first?
You know what? I think I like to talk about the one that might be of interest to a lot of our viewers first, but it's short, and then we can dive into the Black Health Education Collaborative and the primer. But what I would love to talk about is health caring differently. I'd really like to talk about that because I think that's very much connected to what I've been speaking about, right? So health caring differently is a social media initiative. We call it like a movement to encourage, so you're able to scroll down. Yes, great. To encourage youth to explore the field of medicine and healthcare leadership from diverse communities. And for me, it's really important to expose youth to folks, not only because they're different. So I think in that picture, you're seeing only Black folks, but I have Indigenous folks on and South Asian, like very, very diverse, different guests. And, you know, the thing that I make sure the guests are able to do is talk about how being different, like their journey into medicine or into healthcare, they take who they are. Like, you know, just earlier tonight, like we had our last episode for this season, and Dr. Nahid Dosani talked about, you know, being of South Asian ancestry, but his parents coming to Canada as refugees from Uganda, and how his understanding of, you know, people who are struggling, now he works in hospice care and palliative care, but does a lot of work with, you know, racialized folks, minority folks, and the homeless. And so he's got this, you know, movement called Radical Love, right? Where they provide care, hospice care to homeless people who are at the end of life because it's really hard for them to get palliative care. And so, but he created that initiative because of his life journey of feeling, you know, as an outsider, you know, and coming up from a low income background. So that's just an example, but I want the youth to see that in healthcare, we need them, you know, so whether they're in high school and, you know, they're different or they're struggling financially or they're Black or Indigenous, whatever, healthcare needs them. We need all of those perspectives so that we can better provide care to all of the different folks that who need us. So it really is like a whole movement. And so, you know, folks can follow us at Health Caring Differently is the handle, but also you can just go on the website, healthcaringdifferently.com. But yeah, so we're just, you know, finding ways to inspire the youth because, and this is true actually for Canada and the United States. I don't know if you knew this. 1 in 5 medical students has a parent who is a doctor.
No.
Oh, yes. Oh, yes.
No, actually, that would make sense. That would make sense. Yes, that would make sense. Sorry to correct. I went no, but I really think, yes, I get you. I get that.
Yeah, because there's an interview process. There's a whole process where they want to know, do you understand the field of medicine? If you don't have a mentor, you don't have somebody to show you that, you wouldn't know. So what this initiative is about, I say, you know what, I can't change who people's parents are, but I can be an auntie. And I can take those dinner table conversations that those kids whose parents are doctors, they have access to all kinds of information that just happens at the dinner table. I bring it to Instagram Live. So I tell them, it's like, I'm their auntie. I'm bringing the tea. I'm bringing the biscuits and I'm bringing my friends with me. And you're going to hear our stories. And then on top of that, we have a newsletter. So there's the inspiration when they come for the video, you know, the Instagram live, and they ask questions and, you know, we give them that kind of thing and encouragement. But then in the newsletter, which is available on healthcaringdifferently.com, we give them the information that they need for the different pathway programs. So that's specific to Canada. Since, again, we were talking about the murder of George Floyd, or I brought it up, since the movements around awareness around anti-Black racism, we went from 1 or 2 pathway programs for Black students to enter medicine. There's 10 of them across Canada right now. But a lot of people don't know that because it just happened like during the pandemic. So we want to like level the playing field. There's all kinds of high school programs that hospitals do for diverse students. So it might not, you know, diverse backgrounds or lower income communities, but not everybody knows about it. So my role is to amplify it and let them know where they can get mentors, where they can get support. And that's it, because a lot of the programs already exist. It's just people don't always know about them. So it's a beautiful thing, and it gives me hope because the young people coming up now in medicine and in other areas of healthcare like nursing or physiotherapy, they are learning about the harms of racism. And that's what we'll dive into later, because that's part of my other work, is to teach medical trainees and healthcare professionals about the harms from racism, specifically anti-Black racism. But it's happening, and they're learning to see the full patient and not just the heart attack in room 3 and the brain cancer in room 1. That kind of dehumanizing behavior doesn't only affect Black or racialized people. It actually dehumanizes everyone, including the provider. Reducing other human beings to just a disease, it's not good care, and it's just a very harmful way to think about people, but it's very much embedded in medicine. So we have to unlearn it. We have to unlearn it, and it's happening. So that's my other project, but I'll pause here. I'm talking a lot.
No, you're just sharing. It's I'm just steering the ship. You're driving the ship. Want to ask in regards to Blacks, young people getting involved in the area of medicine, are the institutions providing proactive means of them knowing about what's available? Because many times I will go into, oh, well, we don't know anybody out there. We can't find them. Do you get that? Do you hear that a lot, or is that beginning to reduce? Because the talented people are out there.
Yeah. I think since the pandemic, so for instance, during the pandemic, I was the president of the Black Physicians Association of Ontario. And, you know, I think, first of all, the physicians themselves, some of them, after experiencing so many things in their training and things like that, weren't very kind of like out there or vocal. So that's also part of it, but became much more vocal and engaged in community. And so their visibility has increased. And the new president right now, Dr. Mojola Omole, I think you're having her on soon, or you had her on recently with Chennai. Like, she's got a social media presence, right? So I think people are seeing that more than in the past. Mm-hmm. And there's more advocacy, because I think before, as Black physicians, when we would speak out, people were afraid, right? Because there would be repercussions, right? And so, like, I speak out, but I'm a little bit strange. Like, right. Overall, it makes sense that people were worried about their careers and, like, you know, being really vocal. But now that's changed quite a bit. And then I think when it comes to the resources, so for instance, like healthcaring differently, that's still a challenge, because what we've noticed is that a lot of the high schools, and I'm sure it's the same thing in the States, oftentimes the guidance counselors don't give the young people, that's part of why I'm doing healthcaring differently. It's because these programs exist, but then are the youth who are supposed to know finding out? Again, there are studies that even when Black children, so if Black children do the wrong thing, they're hyper visible, right? You pass a note in class, you laugh, you're going to the principal's office. But when there's also studies to show that when Black youth are doing really, really well, they're rendered invisible. And so they're not seen as excellent by their teachers, even when they have the standardized, you know, provincial tests or the state tests, and they perform really high. You ask their teacher how they're doing, and their teacher says they're okay. but they performed with excellence. And so when they're seeing that, I know many students who are in medicine and research, Black students, who when they were in high school, their guidance counselors told them that they couldn't get into medicine, or they, didn't have the potential, or they should go into other fields because medicine is competitive. So the information is not always getting out there. Either when you're finally a doctor, right? It's not like they're going to put it on the news like the Black community papers will when you finish. And then even when you're thinking about medicine, even when the opportunities are like right there, sometimes the teachers and the guidance counselors do not tell, the Black students about it. So there's still gaps.
Understood. Okay. What's next on the hit parade, Dr. O?
Woo! Okay. So, again, I don't just like stay and complain about a situation, right? I said we as doctors are creating harm, and healthcare providers, not just doctors, but doctors really, we take that oath to do no harm. So I'm really proud of two things that are to change the game, I guess, when it comes to addressing anti-Black racism in healthcare. One is that, so I'm the co-founder of the Black Health Education Collaborative, which is we're a group of Black scholars. So we've got researchers, PhDs, and physicians and clinicians across Canada who came together to create content on anti-Black racism and Black health, which we call the Black Health Primer. And so the work that we've done for the first time in Canada is there is a resource where almost like a textbook, but it's online learning that launched in March so that medical students, nursing students, health professional students, and those practicing. So if you're already practicing or you're a healthcare leader can understand anti-Black racism in Canada and its impacts on health and how to do better. So we've also got stories, like I mentioned, in cancer screening, we've had successes here of using Afrocentric approaches to cancer screening and engaging in community and our values that have resulted in, in one clinic, Taibu, tripling the mammogram rate, right? And so we talk about how healthcare can be done well and how it can be done in solidarity, but we also talk about some of those terrible situations that have happened in medicine where Black people have been mistreated. And so the primer is there for all people in healthcare to learn, like I said, about anti-Black racism, its roots, that we had slavery in Canada, okay? We always hear about the Underground Railroad. We had slavery in Canada for centuries. The Underground Railroad was only for 30 years in this short amount of time that slavery was abolished in the United States and abolished in Canada. So it's about a 30-year gap. We only hear about the Underground Railroad, not about the slavery that happened here. In our health primer, we do that. And that's not it. That's not all, because this health primer came out of when I started teaching about Black health. So I'm faculty at the University of Toronto. And I was the first one in Canada to be tasked with or taking on the task of teaching medical students about, Black community health and anti-Black racism and how it affects our health. And I tell you, the students were like, okay, that's great, but is it going to be on the exams? So now the next thing that the Black Health Education Collaborative has done is, for the first time in history, and you had it, plastered across the screen, for the first time in history, we now have learning objectives on Black health, or examination objectives. So to become a doctor in Canada, very soon, the students will have to answer questions on anti-Black racism and its impact on Black health. And my understanding is that is not yet the case in the United States or the UK, based on the comments of support that we got from our colleagues, our Black colleagues in the United States and the UK. But in Canada, so our team, the Black Health Education Collaborative, developed the standards, and we did that based on research work that we had done engaging Black physicians, nurses, like scholars across the country. So we didn't just sit there and make up our own thing, but we engaged folks and then met with the Medical Council of Canada. And so those examination objectives were released just, this month. It's still April 30th, but April 2024. And then it'll take a few years for the schools to make sure everybody is learning that kind of content, which is available in the Black Health Primer. And then it'll be on their exams. They're going to have to know how does anti-Black racism have an impact on diabetes? How does anti-Black racism play out in sickle cell, where patients say that they are in pain and not taken seriously? How does anti-Black racism play out when it comes to Black children and the adultification of Black children, where they're treated like big woman and big man when they're still very small children? So it focuses on anti-Black racism, but it's so that you can link it to the medical conditions and things that we see in healthcare and in life. So
there we go. Always like to celebrate wins. Give us some of the journey it took to get to this point right now. How did this start, and share some of the journey to what we're seeing if you're watching live on the replay on the screen right now, because it just didn't happen magically.
Oh my goodness. I mean, it took some Black girl magic, but it didn't happen. Okay. Wow. Okay. So, like I said, when I was at the University of Toronto, when we created the first, so U of T, led by Ike Okafor, actually, we had both the Black student application program. So it was a more culturally appropriate way. So the students actually have to have the same standards if you're Black, but it's a different pathway where your application is looked at from a predominantly Black number of faculty. Sure. And when you come in, you're welcomed by the Black Medical Student Association. So you get that kind of like love, basically, intentionally. And then at your interview, there's usually at least one Black person there, right? But everything's the same. Anyways, but when that was established at the University of Toronto, what went with it was to have a faculty member teach about Black health. And they were following the model because U of T already had that model for Indigenous health. They had an Indigenous application program and an Indigenous person teaching on Indigenous health to the whole class. So I was so excited to do that, only to realize, like, A, we talked about it, Canada doesn't have very good data on Black communities.
Right.
B, I'm coming in as this lone person in all of Canada, the first one to do it in a medical school. And I want to be able to speak with authority on, like, this is the approach to Black health. But I felt really intimidated. Like, I'm just me. You know what I mean? Who am I to say what is the health of Black Canadians and what's needed? And then the other thing was we were either misrepresented or erased. So like I said, Black people have been here in Canada for 400 years, but we're not represented. If you hear about Canada, you don't think of Black people, right? Like in Toronto, we're about 10% of the population in Toronto. So either students don't learn about Black skin, Black representation or anything like that, or they only learn about what's going on in the United States, like as if we didn't exist. They would also learn things as if, so this might also catch you by surprise, race is not biological. So race is just a made up thing. Yes, we come from Africa, but Africa is the birthplace of humanity in the sense that we are so genetically diverse if you come recently from the continent, right? Like so much diversity, but then lumped together as if like all Black people have a particular problem. So I'll give you an example. You could take something like sickle cell. You see it more in West and Central Africa, but you could see it in the Mediterranean. You could see it in parts of the Middle East, but you don't really see it in places like Ethiopia or South Africa. It's not the whole, everybody who has a certain skin and hair where you get sickle cell. Very similar for triple negative breast cancer. There's things that we talk about as Black, but they're not. You have to think about where we came from in our ancestry with regards to the transatlantic slave trade. It's just a certain region. It's almost like if you have a certain health condition that is only happening in the Dutch, but you assume it's like all white people. It's like, no, it's a particular geography and, an ancestral group that was moved across, North America and the Caribbean and South America. So a lot of the differences that we see in race are not just because of genetics. It's actually often because of the extra stress of life that we experience as Black people. This is what I tell my students. You hear that Indigenous people have diabetes at an earlier age and more diabetes than, white folks. You hear that Black folks have earlier presentation of diabetes and have it, at an earlier age than white folks. You hear that South Asian people have the same problem. And I'm just like, is it that the thinking is we all have the same mutation? Or do we have to start to look at our situations and the way that we're treated in society and how that takes a toll over time? We even know the healthy immigrant effect. People will migrate to Canada or the United States and be in good health, and then in a very short amount of time, 5 to 10 years, have worse health, right? People who might have been carrying TB back home, but just fine, come here and it activates itself. It's the stress, right? It's the being treated, it's the having to work 10 times as hard. And so it takes a toll after a while, especially once you see people get into their 40s and 50s. All of a sudden you see cancer, all of a sudden you see diabetes, you see high blood pressure, and you see that in these other racialized groups. That's not biology. It's biology, but it's not from a biological cause. You have to start look at the system when you see these types of patterns. And so that's the kind of thing that I ended up teaching in the school, but I was like, we need to go national, because the students, the other reason it matters is that if you think that Black people are sick because something's just wrong with them genetically, then there's nothing you can do about it. If you realize that our situation, right, the extra barriers, the extra stress, no one's calling you the N-word, I'm saying, but it's the extra layers of stress. Again, you can't get the housing as easily. You're parenting while Black. It's just harder to get that promotion, or you decide to leave the job market completely and start your own business, but you're on that hustle, you're in that grind. By the time you hit 40s and 50s, you start to see differences in health between ourselves and our white counterparts, right? It takes a toll. And so it matters, because if it's just biology, nothing you can do about it. If it's our situation, so if it's a mutation, nothing. If it's our situation, then there is something we can do about it. There's something society should do, but there's also things we can do. And so it changes the narrative, and that matters in medicine. How you talk to the patient, how you understand it, how you help them access resources, how you don't make it worse by making assumptions about them. So that's how I started off. I had to take on that task. And once I got a good hold of it, I was fortunate enough that another person got a similar job out in Halifax, Nova Scotia. So that's in Eastern Canada, Dr. Onnoram Dryden. So she's the co-founder with me. We're both co-founders. And we had the benefit of bringing together a whole team, then getting topsy-turvied by the pandemic. But the awareness that happened through activism meant that we did end up getting funding from University of Toronto and Dalhousie. We got seed funding. And what the hospitals and universities, were telling us at that time, because before they were like, anti-Black racism, what is that? But after the protests and the activism that occurred, they were like, oh my gosh, what do we do? Please help us. So they said it can't just be limited to medical students. They were like, they said it. They said doctors need to know this. Nurses need to know this. Nursing students need to know this. So we had to broaden our lens. And I'm grateful for that. But it actually came from healthcare leaders saying this is a problem. But the recognition that it was a problem came through activism after the murder of George Floyd.
Right. So little time left, and you've been so fantastic. So let's see how I can squeeze in 2 or 3 quick conversation points. As a respected member of the medical profession, a Black woman or African Canadian perspective, we have an American audience here, share 2 or 3 differences, if at all there are any, with Black healthcare in Canada versus the United States, if there are any.
It's hard to make comparisons of healthcare because we don't collect enough data. We know, if we're speaking about Black women, we know that when it comes to birthing outcomes, our outcomes for Black women who are pregnant with regards to preterm labor and poor outcomes for our babies and for ourselves. Where those studies have been done, it's pretty similar, unfortunately. We do know that when it comes to, discrimination in education and housing, so all of those other factors that are determinants of health, sometimes it's actually worse here. And then we do know that, I don't think we need to get political, but having a universal healthcare system does help. So we do know that when it comes to access to care, because we have a universal healthcare system, we don't see the same level of people who can't access care because they are Black or low income. The quality of care is a different issue, but being able to access, like get to the hospital, that kind of thing, is less of an issue here. But aside from that, where most of the time, wherever data does exist around like policing or housing or education, it's either the same or sometimes it's worse in Canada.
Got a quick comment here. Bridget says, I have certainly noticed racial disparities in kidney health, early intervention, and transplant.
Yes.
All right. Two more quick pieces. What is the next step for you and your initiatives?
Oh, the next step. So I could say for the Black Health Education Collaborative, because we're in Canada, we'll be translating the primer into French, right? So it's available for healthcare providers. And we welcome our international healthcare providers. If you want to check it out, then you saw on the website where you can go and register. There's a fee for anybody, not just if you're international, but to translate it. But then in the next couple of years, our work will be focused on like family medicine, primary care, and not just, general primary care, but we're looking at like Black youth and mental health, senior care, so Afrocentric care, and skin care, hopefully, so dermatology, but making sure that family doctors across Canada are better positioned to serve Black communities. So that's a direction that we're heading in. For health caring differently, like I said, we're on Instagram Live, but we're hoping in the fall that we can follow Dr. Vibe's lead and be on multiple platforms at once. So hopefully you'll see us on YouTube Live and TikTok Live, if TikTok still exists in the fall, we'll see.
Yeah.
But yeah, so we're hoping to be on multiple platforms and have even more resources for youth to be able to explore the field of medicine and other healthcare professions.
All right. Last conversation piece. What is your message to our African women around the world when it comes to health?
Oh my goodness. I have to quote African-American author Trisha Hersey when she said, rest is resistance. So we didn't talk about it here, but I am just finishing my sabbatical. Finishing my sabbatical. I took time off to be with my children, to travel with my children, to rest, and then I embarked on these projects, and I'm back at U of T like fully in July. But so these are my creative projects, but I actually took the time. I had a loss in my family. I lost my mother. I took the time to grieve. I took the time to rest. I took the time to be with family. I took the time to be with my children. And I can tell you that it is restorative. I can tell you that the doctors were investigating 2 lesions in my breast. I'll be honest here. And those have disappeared. We thank God. They've completely disappeared during this time that I took off. And so my one, recommendation to Black women, African women, is however you can, whether it's in the shower, whether it's on the weekend, whether it's, just after church, however you can fit it in, try your best to have a moment of rest. And sometimes we have to help each other as women. I had women who sometimes help me watch my kids. We have to continue our traditional ways of being there for each other and lifting each other up and giving each other the opportunity to rest as well. And so I'm very grateful for family members and friends who helped to lift me up during a difficult time. But if we don't rest, you even recharge your cell phone, right? It needs a moment. So we do too. We do too. So much love.
Well, first of all, condolences on your loss. And I know you're continuing the legacy that your mother set and foundation on. So we embrace and we lift you up, and let you rise. And also, I will just add to that, I always say to people this analogy that there's a very famous race. Well, whenever you see like Formula One racers or Indy racers, how many of them finish on one tank of gas?
Good point.
They have to go for their pit stop.
That's it.
So I just piggyback on what you just shared there. Dr. O, thank you. Here's the places, website, and it's all in the chat or in the comments wherever you're watching this live or the replay. It's all there. The Black Health Education Collaborative, it's there. Health Caring Differently, it's there. Black Health Primer, it's there. It's all in the comments chat, all over the place. Do not be a stranger. I know once you get back to it, we may not be able to catch you, but when you have a minute on one of your pit stops, we'd like to fill your tank by coming back on the platform. And thank you for everything you have done, are done, and will be doing to help us rise.
Thank you for having me. I'd love to come on in the fall to talk about Afrocentric geriatrics, how we have to.
Please, yes, let's do that. All right, here say, Bridget says, thank you for sharing this information. There you go.
Thank you.
All right. Well, don't just manage your time, manage your energy, and remember to give yourself grace. Peace. All right, family. Epic conversation there. Dr. O rocked the house. And you know what it was like to try to get a hold of her? My goodness. She all over the place. Big shout out to Anita for making this happen. So really, really appreciate it. And again, all the contact information is in the comments section, wherever you're watching this on replay. If you're listening, you're going to have to watch it on video some way, somehow. As always, please subscribe to the Dr. Vibe Show on YouTube and hit the notification button. Also, follow the Dr. Vibe Show on Facebook, LinkedIn, and Instagram. If you want to advertise your business product or service on our show, please email me at dr.vibe@thedrvibeshow.com. And you can watch replays of this epic conversation at the Dr. Vibe Show on YouTube, LinkedIn, and Facebook, and on my website, thedrvibeshow.com. As always, we end off our conversation like this. Live your life as a dream. If you can dream it, you can make it. Sometimes you have to get small to get stronger. Block assumptions, then aim bigger, aim better, aim higher, aim wider. Love, faith, and respect. And don't just manage your time, manage your energy. And remember to give yourself grace. God bless. Peace be well. Keep the faith and walk good.